Degenerative disc is essentially arthritis in between the vertebra or the bones in your back. The disc typically serves as a shock absorber between the two bones, really acting as a cushion. Occasionally those discs will start to degenerate and become a little bit thinner over time, and when that happens, that can lead to back pain. Typically people will describe the pain as being achy and constant. When that does happen, there are treatments available. Oftentimes treatments will revolve around building strength in the back to help take pressure off of those discs. Occasionally we will utilize other means, including injections or even occasionally surgery in these situations, all with the goal of helping to decrease the pain and resume your normal activity. With degenerative disc disease, there is no cure. However, the treatments can be very effective and can provide months, if not years, of relief. If you are experiencing symptoms of degenerative disc disease or back pain, please give our office a call. We can set up an appointment with one of our spine specialists to create a treatment plan for you to help resume life and your regular activities.